Good evening, friends, and warm welcome to this talk show on vitamin D. Now, we speak about vitamins all the time. We know that they're important for our vitality, for our strength. We also speak about vitamin D. We call it the sunshine vitamin. And we know that even though we can get it free from sunshine, uh, environment is such, biology, physiology is such that we do need a little bit of support from nutraceutical products. We also know that India is blessed with sunshine. However, we are a heliophobic nation. We are afraid of the sun. So you'll find that we prefer to remain indoors. Even if we do go outside, our clothing is such, it's quite modest. It is such that we prevent exposure to the sun. We use sunscreen lotions, and they prevent ultraviolet radiation from reaching our skin. So people have been speaking about vitamin D forever and ever. Even when you look at our epics, the Mahabharat, for example, or the Ramayana, you find that there are characters who clearly had vitamin D deficiency or who had osteoporosis. So, a question for everyone, please feel free to share with us in the comment box any character that you know from the Indian epics, the Mahabharat, the Ramayana, any other epic which talks about vitamin D deficiency or about osteoporosis. And the hint to the answer is you will find the answer in IJCP, Indian Journal of Clinical Practice. But let's fast forward and let's come to the present day. Now, recently I learned that there are different types of tenses. I was practicing English language. So we have past, present, and future tense. And then in each of these, we have different types of tenses. And here my English gets a bit rusty, but you have simple past, then you have continuous past. One of the things that is continuing in the present, it is continuous present, is the COVID-19 pandemic. It's now called an endemic. And when COVID-19 came, we realized that our immunity was found lacking. Most of us did not have the immunity to fight vitamin D, to fight COVID-19. We began searching for ways in which to bolster our immunity. One method was to get vaccinated. But then other studies came which told us that if you manage your diabetes properly, if you reduce your body weight, if you take a high protein diet, your immunity goes up and you can fight the COVID 19 virus more effectively. But the simplest thing, perhaps, that one can do to enhance one's immunity is to take vitamin D. And it was found that people who are replete in vitamin D, people who have adequate vitamin D stores levels, are much better at fighting disease than those without. Now, disease can come in various shapes and sizes, but one common disease, not only COVID 19, but other diseases, one common type of disease is that which affects the lungs. You can have infections like pneumonia or COVID 19, and then you can have non infectious diseases of the lungs. Bronchial asthma is one type, another is COPD, chronic obstructive pulmonary disease. In this setting, what role does vitamin D have? Does vitamin D act upon immunity per se? Does it help improve the immune status of the body so that the body can fight diseases such as infections, pneumonia, viral pneumonia, and also inflammatory diseases like asthma, also structural diseases like COPD? Or does vitamin D act on the musculature, the chest musculature, and strengthen the muscles of the chest so that we can breathe better and fight disease? We need to find answers to this. And for this, we need an expert with us. There are other issues as well that come to the fore. And recently, we all celebrated International Day of Yoga on the 21st of June, just 2 days ago. I was thinking about yoga and what it is. Is yoga a panacea for all disease? Will practicing yoga eradicate all disease? Will it eradicate death? Maybe no. But will practicing yoga improve quality of health for everyone? Will it help us enjoy our years on earth a little bit more? Will it help us improve the efficiency, the efficacy of our body, our human body, a little bit? The answer is probably yes. Will it also help our mind? Will it help us in mental, emotional, spiritual health? The answer is certainly yes. So, then thinking about yoga from a vitamin D and immunity perspective, that also kept me thinking. The Surya Namaskar that we practice, is that a way of getting more vitamin D? Is it a way of just improving the flexibility and balance of our muscles? Is it a way of improving spiritual health? Or is it all of the above? This is also something to consider. And if we can integrate yoga into our practices, we will be doing a good service to our patients, to our fellow citizens, to all mankind. Today, I was speaking about person centered medicine to a group of DNB students. They are doing medicine and endocrinology. So, uh, speaking about person centered medicine, what we spoke about was how do you choose the right exercise? How do you choose the right vitamin D? Each person will have different likes and dislikes. Some people may want injections, others may want capsules. Some may want vigorous physical exercise, others would want something softer. Some would want only physical exercise, others would want a combination of mental and physical exercise. So each one to his own needs and wishes. And that is how person centered medicine also helps us understand what kind of service we should give our patients. For this, also, we need an expert to teach us. And I welcome all guests with us. Hi to Michael Hauser. Warm welcome to our Vitamin D talk show. And Ashu Safi wants Dr. Sanjeev Malik's number, but I do not have the number, Ashu. I am sorry. If you can help me more, where is Dr. Sanjeev Malik from? Maybe we might be able to dig it out for you. Which city and which specialty, Ashu? And Jasmeet Chopra ji says that she has vitamin D deficiency. She also has polycystic ovary syndrome. So don't worry, we'll ask our guest and let's see how we can fix it up best. Alpa Patelji points out Vidur and Ashtavakra. These are characters from our epics who had bony deformity. Ashtavakra had 8 deformities, 8 types of bends in his body. But he was blessed with exceptional intelligence. Vidur was also blessed with exceptional intelligence. Vidur happened to live in Kurukshetra in Hastinapur, right next to where I live in Karnal. And good evening to Anamika Anuji. Alpa Patel points out that Kubja also had bone deformity. Yes, that's right. And one more, Alpa Patelji, or anybody else, if you could mention, anyone who started the Ramayana, the entire story of the Ramayana, who was the villain of the entire story. Ravan came much later, but who began the entire story? Who was that person and what disease did she have? Joy asks for one episode on protein intake in vegetarians. Yes, that's an important point. We'll take that up sooner or later. And to Seemaji from Kolkata, warm welcome. Yesterday, our guest cancelled at the last minute. That is why we couldn't have the session yesterday. We are here with you today. Otherwise, the times are the same, Monday and Thursday, 7 to 8 p.m. Thanks, Jasmeet. And thank you, Dr. Talla, who is a psychiatrist from Roorkee, for joining us. Hi to Ajab Parihar, Ali Nazakat Sahab. Mantra is the right answer. And Harshi Dhingraji, Dhingras are my in-laws. So for your question, let's go to our expert. And our warm welcome to Dr. Agam Vora from Mumbai. Warm welcome, Dr. Agam.
Oh,
Dr. Agam is with us. And he's vanished again. Dr. Agam is from Mumbai. He is the secretary of API, the Association of Physicians of India. He is a respiratory physician as well. And he'll be the right person to speak to us about vitamin D, especially with a focus on respiratory disease, COVID-19, and general immunity. Like Joy says, spine deformities were there in many people, including Kabja, including Manthara. Manthara, like Jasmeet Chopra ji says, and Joy ji also says, she probably had osteoporosis. She was bent at the back. She probably had a fracture of the spine related to calcium deficiency, to osteoporosis, and that would be the probable diagnosis. Dr. Tala asks about vitamin D and diabetes. This is in the news. We have always known the musculoskeletal effects of vitamin D deficiency. Now we are learning the metabolic effects of vitamin D deficiency. And vitamin D supplementation has been shown to prevent onset of diabetes. So if you keep yourself vitamin D replete, the chances of developing diabetes and pre-diabetes go down slightly. We welcome Madam Savita Bhutani as well. There is this question from Harshi Dingra. While we wait for Dr. Agam, let me take this. Uh, Harshi says, which dose is better for vitamin D maintenance, 60,000 once a month or 22,000 units per day? The ideal would be to take 60,000 units once a week for 12 weeks. So you take a 12-week pack. And then once that is done, then you can move on to 60,000 once a month or once a fortnight. And Dr. Agam is back with us. Warm welcome, Dr. Agam. Dr.
Hi,
Agam is
Dr.
like,
Kala. How are you?
welcome. We were thinking you're like Mr. India. So I'm reminded of this movie. The movie
Thank
was
you very much
made
for
in
having me here.
Bollywood. Yeah. So, and this is what entire India is saying. करते हैं हम प्यार डॉक्टर आगम वोरा से मिलना हमें सवार डॉक्टर आगम वोरा से पर डॉक्टर
Ah,
आगम वोरा दिखते नहीं है. We don't see him.
wow.
Just like way you can't find Mr. India. But now we got our special spectacles, special goggles, special glasses. Now we can see you. So warm welcome, Dr. Vora.
Thank you very much, friend.
People from across the country greeting you, including J.S. Kathuria Saab and Jasmeet Chopra ji. Uh, we've already
How
introduced
nice.
you,
How nice. My pleasure.
Secretary of the Association of Physicians of India, and also a renowned respiratory physician.
Yeah,
Sir,
please, please.
what
Sure, sure. Thank you very much. I'm
we've
sure you will
introduced
deliver.
the topic as well.
You will only
What would
please.
you, yeah, what would you like to speak about today?
So, yeah,
Yes, the floor is
do we
yours.
start?
Sure, carry on.
So, friends, ladies and gentlemen, good evening, and special thanks to my friend Dr. Kalra for not only visualizing the need for discussion of this important topic, but also successfully executing it with the signature perfection, and making me part of this web meeting. I'm also very grateful to team Alkem, team IJCP for connecting me. As I'm told, there are hundreds of friends across country who have already logged in, and that speaks about popularity of this program. And I'm told this program happens regularly, twice a week. Friends, welcome to our web meeting today, where we'll be discussing the fascinating topic of role of vitamin D3 and immunity as we navigate the challenges of this modern world. Understanding the impact of these essential nutrients on our immune system is increasingly important. We've all seen that every COVID patient does not progress to have very bad outcome. We all have seen that all those empty positive patient does not progress to have tuberculosis. We have seen that all those HIV positive patients may not develop full blown AIDS in their entire lifetime. And there is something beyond disease factor that decides the outcome, and there comes the role of immunity. And micronutrients play a vital role in maintaining your and my immunity. In recent years, there is growing interest in research in relationship between this vitamin D and our body's defense mechanism. So vitamin D3, as a lot of you might know, and I'm going to show that you in my slides again, is known as sunshine vitamin. And it's one of the vital nutrient that a body produces when exposed to sunlight. However, it can be obtained through certain foods and supplements as well. The significance of vitamin D3 not only lies in its well established role in maintaining bone health, or what Dr. Kalra was just talking about in its connection in mythology, but also has a potential influence on our immune system. And you have multiple studies over decades which speaks about adequate levels of vitamin D3 and the impact on various aspects of immunity, including strengthening your body's defense against infection and reducing the risk of chronic illnesses. So, friends, during our time together, next 30-35 minutes or so, we'll explore the mechanisms through which vitamin D interacts with our immune system. We'll dwell into scientific research and examine how it is essential that vitamin production and function on its effect on immune cells, regulation of inflammation, and modulation of body's response and the interaction with bugs. We'll discuss the potential implications of vitamin D deficiency on immune system, considering prevalence and inadequate levels of vitamin D in certain population and in your and my patient population as well. We'll also examine various sources of vitamin D3 and factors which can influence the absorption and utilization in our body. So, friends, if you're ready, with the permission of Dr. Kalra, let's begin our journey together for next 30-40 minutes on this vitamin D3. I don't know if my slides are visible.
Not yet. Not yet.
How?
Yep. Now they are.
This is Mangesh slide. I think there is some. No, I think this is not the slide.
This is yours. This is yours.
No, this is not my set of slide. How do I do this? Anyway, we can. That's hardly fine. So then, what I had in mind to do so is to present some of my data. When I was looking at, preparing this talk, I looked at what is happening in my patients. So Sanjay bhai, what I did is I looked at. Uh, um,
If you can share the slides with me, if you can mail or WhatsApp them, I'll share them for you.
do I send you the? How do I send you the? Do I mail it to you? Anyway, forget it. So what I was looking at it, we can always run these slides. What I was these are slides which are mainly focusing on diabetes. So then, and you there cannot be any better person than you to talk about this. And I wanted to put my focus only on respiratory issues.
No, so that's what we'll do. Just mail me the slides. Mail me the slides or WhatsApp them. I've sent you the email ID as well.
Do I mail them to you?
Yes, sure. Email ID is written in your WhatsApp.
That would take unnecessary. Anyway, I'm so sorry. BRIBEKNI.
BRID
BRID
KNL. EKNL. Yes.
KNL, right?
Yes.
I have. I'll,
So, to everyone, just bear with us for a minute. While we wait for the slides, let me take some questions which everyone has asked. Dr. Tala asks about normal vitamin D levels. Dr. Agam will cover that. Seemaji from Kolkata points out that finger millet is a vegetarian source of vitamin D and calcium and iron. And because vitamin D is required for the absorption of calcium, that is right. Ragi is a good drug, is a good food to have. Let's enlighten us ourselves with today's session, she says. And she expects a solution to strong bones and stronger immunity by the end of the session. Questions from Dr. Nitin Narula, vitamin D6 lakh units. Again, Dr. Agam will cover. And this one, let me take vitamin D and thyroid. So, sir, vitamin D deficiency, this question is from Dr. Tala. Vitamin D deficiency will not cause thyroid disorders. But in thyroid disorders, hypothyroidism as well as hyperthyroidism, bone metabolism is impaired. So, you have a greater chance of vitamin D deficiency as well as calcium deficiency. And therefore, in most uncontrolled patients, uncontrolled hyperthyroid, uncontrolled hypothyroid, we do supplement vitamin D and calcium. If the patient is well controlled, Then you treat as per standard of care as you would treat any other person. The best absorbed form of vitamin D, the quality has improved a lot now, Dr. Nitin. And now we have capsules, soft gel capsules, where the absorption is excellent. Why does the deficiency occur when we stop taking vitamin D? Because it is a nutrient. So you have to supplement, you have to replenish every day. So every month. That is why we ask for maintenance dose every month. And just a minute more, and then the slides will come.
I have sent it to you.
Come, okay. In the meanwhile, Dr. Agam, we have people from across the country. Dr. Tala is a renowned psychiatrist from Roorkee.
How nice. How nice.
And
So you made me
perhaps,
popular today. Had
yeah,
you not
perhaps,
been there, I would have never met him. I'm so happy.
uh, Dr. Agam, your take on time, mind body medicine, especially from a pulmonary point of view.
Amazing. I think that's really very interesting topic. I think for any disease, mind plays a major role. It's the anxiety, it's the stress, it's the depression, which would I always say that stress would need a system to manifest. Whenever you are anxious, whenever you have any sort of mind disturbances going on, it would manifest through any of the system. So like I generally talk about asthma exacerbations are definitely going to be more when they're mentally disturbed. And when you take care of these issues, most of the disease, it gets easier to control them. I think i think I have developed and everybody, for that matter, when it comes to respiratory, people have known for years together the role of yoga and pranayama. This has profound impact on your mind, and your mind is the center from where a lot of, I mean, the psychiatrist sir would know it far better than me, you being endocrinologist would know it far better than me. Most of these signals which come from brain can be altered with your better mind management. You got the slides, Sanjay?
Yeah, got them. Yes, just downloading
And
them.
that's how, whenever you tell your patient, and Sanjay, I also believe in the vibration of place. Whenever I interact with my patients, I tell them it's not only meditation, but where you do meditation, that also matters. I tell them, even if you don't understand much about meditation, go and spend some time in temple. In however foul mood you are, you go to any temple, you feel good. The place has got their own vibration. However good mood you may be, and you go into, I mean, nothing against any specialty, but you go at police station, or you go at court, and you feel like getting out of that place as soon as possible. So I think those places also have tremendous vibration on your mind.
That's true. And the people around you as well.
True.
So I hope the slides are visible now. Backstage, Pratik,
Fine.
can you see the slides?
I can see it. Thank God.
You can? Okay. So
Fine.
I'll,
So the whole idea was to talk about vitamin D and immunity. And will I have to ask you to? Acha, okay. My sincere thanks to my teacher, Professor, Director Dr. K.C. Mohanty, and of course the entire team, Sanjay here, and all of you friends. So I was talking to Sanjay कि भाई program करना है. I was really very excited, but I asked him, okay, Sunday. He said no. I said okay, must be Saturday. He said no, Agam, it's got to be on 23rd June. And I said 23rd June. What's so special about 23rd June? And Sanjay sent me this slide. So friends, allow me to share with you that today is a very important day. On the same day today, Christopher receives patent for his typewriter. Interesting. Jamal Abdul Nazir was elected as president of Egypt on the same day. Arctic Treaty was concluded on the same day in 1960, where Arctic continent was declared protected for scientific activities. Same day in 1991, African country Moldova was declared independence, and you will be surprised to know that 1995, I'm sure many of you may not know, John Salk, the medical pioneer who developed polio vaccine, died on the same day at the age of 80. Though I was impressed, I told him, ठीक है यार, ये तो दुनिया की बात है, अपने कंट्री में क्या? And he sent me a next slide which says, next please, which says, today is important day as our actor come politician Raj Babbar was born. So Sanjay Gandhi died on the same day, today being his death anniversary, and the Bombay dock work was completed 1810 on the same day. 1985 Air India passenger plane crashed in the coast of Ireland with 329 passengers, all of them were killed. Same day, 2008, selection committee recommended to confer Dada Saheb Phalke Award to Bengali actor Soumitra Chatterjee. And on the same day, 2014, I don't know, Sanjay, whether you visited, there's a place called Rani Ki Vav, and in Himachal, the Great Himalayan National Park, both were included in the World Heritage List. Next, you may not know, but across the globe, a lot of people are celebrating today with variety of themes. Somebody celebrating it as International Rose Day. Somebody's celebrating it International Widows Day. Let it go day. It may be National Hydration Day, a Pecan Sunshine Day, National Pink Day, Flamingo Day, Public Service Day. Take your dog to work day and whatnot. But trust me, history is always created in retrospect. Who knows? Tomorrow, you and me remember this day as important discussion which happened, where Sanjay spoke about vitamin D and its role on immunity, and it may be remembered as day where we will be speaking about vitamin D and immunity. So, friends, what I have in mind is to give you some idea about vitamin D, to talk about vitamin D in various medical conditions, to talk about vitamin D in COVID 19 and lung disease, and quick take home messages. Next, as I was talking to you earlier, Sanjay, I looked at my last 100 patients, what I'm seeing in my practice, and I saw out of those 100 patients, 11 were drug sensitive tuberculosis. 24 had drug resistant tuberculosis, 16 had asthma, 32 had COPD, 7 were respiratory failure, and 10 interstitial lung disease of various etiologies, and they were both in stable state and so called exacerbated state. Next. And I was looking at their vitamin D level, and I realized I had 66 patients who came for follow-up. That means those were my regular patients, and I have a habit of putting them on calciums and vitamin D supplements regularly. And 34 patients were new in the last 100 patients. And trust me, all these new 34 patients had low levels of vitamin D. But more surprising was 20 out of the 66 who were my regular patients and who received regularly vitamin D supplements as per my protocol, 20 had low vitamin D. In spite of them being on regular vitamin D supplements, 20 had low vitamin D, and this 20 were the patients who used to get frequent exacerbations. Next. With that, vitamin D is a micronutrient which acts as a hormone, has an immunomodulatory property, and it optimizes your inflammatory responses. With that, let me spend a minute on next talking to you about what are micronutrients. Micronutrients are the nutrients which are required in very less amount for growth and development of body. And a hormone is a chemical which is secreted in body by endocrine gland, and it circulates in body carrying it out various functions at a tissue and a cellular level. An immunomodulator is any drug or any enzyme or any protein or anything or any medicines which is used to regulate or normalize your immune system. So you may have an immunomodulator which augments your immune system or suppresses your immune system. Next. And vitamin D is making news. Next, you can see that vitamin D reduces risk of diabetes. Next, 8 in 10 people in Chennai suffer from lack of vitamin D. Next, vitamin D deficiency is a big crisis, not in adults, but also in children. Next, be outdoor from 11 to 2 p.m. for healthy bones and for vitamin D better absorption. Next, and you will see this kind of articles every now and then in all your medias. It may be newspaper, it may be magazines, etc. Next, and community is now talking about vitamin D levels. Vitamin D deficiency can give you hell lot of diseases. Rickets and osteomalacia are the most advanced diseases in the sense, in the extreme forms, you will see that. But list is endless. When I was reviewing literature, I realized COVID, influenza, tuberculosis, multiple sclerosis, rheumatoid arthritis, SLE, diabetes, hypertension, PVD, chronic heart failures, chronic fatigue syndromes, depression, cataracts, infertility, autoimmune diseases, cancers, COPDs, asthmas, tuberculosis. Oof, vitamin D deficiency is associated with multiple diseases. Next. And it's a sunshine hormone with this influence on cell growth, insulin resistance, immunity, muscle functions, nervous system, cardiovascular system, low backache, inflammation, and even on blood pressure. Next. Traditionally, regulation of calcium homeostasis and bone metabolism is the role of vitamin D. But we've realized it has effect on autoimmune disorders, cancers, metabolic syndromes, suppressive and augmenting modulation of immune system. So vitamin D, friends, is available as D1, D2, D3, D4, D5 next, but the most important or the most active is vitamin D3 next. Next, that's the most effective component. And photosynthesis happens in skin. So whenever your exposure to those sunlight, preferably during noon times, it is absorbed from the layers of skin next, and it is stored in kidney, gets active as 125 next, dihydroxycholecalciferol, that is the active form of vitamin D3. Next, Sanjay bhai. Next. You may have to do a couple of next. So in liver, it is stored in kidneys. Probably it has got multiple effects on calcium regulation, bone mineralization, bone growth, neuromuscular joints, inflammation, and it is there are various, and that's fine. And on immune system, cytokines and immune regulation. So this is the basic next vitamin D function, and then there are next vitamin D receptors, and you will find vitamin D receptors across the tissues of your body. So across the system and across these cells, you will find them. Like immune system, you will find the vitamin D receptors on thymus, bone marrow, macrophages, B cells, T cells, GI, your esophagus, stomach, your lung alveolar cells, parathyroid, thyroid, pancreatic cells, parotid glands, sebaceous glands, skin, breast, hair follicle. Name the tissues, name the system, and you will find the vitamin D receptors there, giving you idea that vitamin D is vital for functioning of almost all tissues. It has got its effect on innate immunity. Next, it has got its effect on next. I'm sorry, it's so boring to say next. But I'm sorry. And it has got its effects on adaptive immunity. So it works on both. Yeah, fine. It works on both your innate immunity and the adaptive immunity. And recently, next, we've found a gene responsible. Next, we've found a gene responsible that a single nucleotide polymorphism, which is key in maintaining vitamin D metabolism. So the genes which are responsible for vitamin D metabolism, the receptor genes could augment or could alter various other diseases. It could bring about genetic mutation, which can result in disease like rheumatoid arthritis, SLEs, etc., etc. We all know that you need optimal levels of vitamin D3, and trust me, optimal levels are between 50 to 100. Less than 8 is severely deficient, 8 to 20 is deficient, 20 to 50 would be somewhere around insufficient to sufficient, but optimal would be 50 to 100. Excessive would be about 150, and maybe toxicity you will see once the level crosses 150. Next. What are the causes for deficiency? The commonest causes is less exposure to sunlight. So you may be in countries where there is enough sunlight, inadequate sunlight exposure. Luckily, we are in the part of the world where we have enough sunlight. But then use of sunscreens, use of the season, the latitudes, etc., may have its impact. Certain medications that you take may reduce vitamin D3 level, like anticonvulsants, steroids, rifampicin, etc. Diseases like hepatic failure, kidney disease, obesity, malabsorption syndromes can hamper vitamin D levels, and the consequences. Look at that, what it can do. Name the system, and it can give you disease there. Breast, colon, prostate, pancreas cancer could be caused by it. Osteoporosis and arthritis could be by it. Weakness, aches, and chronic fatigue syndrome may be responsible. Type 2 diabetes, multiple sclerosis, RA, asthma, diabetes, heart disease, frequent respiratory tract infection, tuberculosis, and even schizophrenia and depression. Your base could be in vitamin D3 levels. Next. Next. I'm not expert, and I'm sure Sanjay Bhai would add inputs next when I talk about diabetes. But there is next. There's significant association between diabetes and vitamin D, and when I dig more into it, I realize autoimmune disease like type 1 diabetes, it is second most common chronic disease after asthma. Next, and you see the immune cells, genetic predisposition, and environmental factors, all three could be influenced by vitamin D level. And that is the association of type 1 diabetes and vitamin D levels. Again, when I was scanning literature, I came across this interesting fact that there could be environmental risk and vitamin D role in association with type 1 diabetes. Literature says there is a gradient, north to south gradient in the prevalence of type 1 diabetes, and so is the environmental or the sunlight exposure. There is increased incidence in northern hemisphere than southern hemisphere, maybe because of its ultraviolet rays factor. Interestingly, there are areas where type 1 diabetes is zero prevalence, where there is high ultraviolet radiation, and seasonality is also well documented. Seasons when there is high, probably sunlight exposure, there could be better, disease management when it comes to type 1 diabetes. Next. Very interestingly, next about COVID. There are these are slightly old figures. COVID is not there anymore. The pandemic is declared off. But I remember times about a year ago, year and a half ago, where you can look at the mean vitamin D levels and the number of COVID-19 cases. So you have on x-axis the vitamin levels. So supplementing with vitamin D, you elevate their levels from between 40 to 90, and you could see that the risk of them developing COVID was significantly less. Next, not only that, the risk of mortality. Look at the mortality also was kept low in all those patients who we could supplement with vitamin D. Next. There are various ways in which we feel vitamin D may have its impact on COVID 19, and it could be its antioxidant effect, it could be lung protective effect, it could be anti inflammatory effect, and a lot of us, including me, believe that it may have a direct antiviral impact. With this, it gives you protection against COVID 19. Next. And vitamin D levels appear to play a role in COVID-19 mortality was felt long ago, was published in Science Daily, 7th May 2020, and prevents our immune system from becoming dangerously overactive. And patient with severe deficiency are twice as likely to experience major complication. That means people who had low vitamin D level had double the risk of major complications compared to people who had normal or high vitamin D levels. Next. There was an Irish study which speaks about longevity, and it says in aging population, one factor, and that is vitamin D, has a very important role. I was trying to focus on vitamin D and its impact on lung immunity, and I realized that lower vitamin D levels is linked with increased viral respiratory tract infection. So people who have those recurrent respiratory tract infections, I'm sure a lot of you will come across patients who keep on getting those respiratory tract infection with otherwise normal. You do the CBC is normal, the proteins are normal, the thyroids are normal, the sugars are normal, but they come to you with frequent viral infections. Vitamin D could be responsible. It impacts all innate and adaptive immunity, and it is the active metabolite of vitamin D which is locally generated, and it has got immunoprotective effect. Next, Hippocrates, look at that, 460 BC, in his chapter wrote that that using sunlight could be important in treating tuberculosis. This was one of the sanatoria, about I think 350 years ago, when they realized that there were two wings of admitted patients of tuberculosis. Those days, tuberculosis patients were admitted and they were kept in isolation. And on one side, there was direct sunlight. All those patients were getting good sunlight. On the other side, there was inadequate sunlight. And it was observed that patients who were facing sunlight had far better outcome. I'm talking about days when we did not have effective chemotherapy. I'm talking about days when we did not have anti-tuberculous drugs. And we were focusing only on nutrition. And some of you may know that even milk therapy, even injectable milk people have given. And during those times, it was sensed, it was realized, it was perceived that vitamin D could have impact on tuberculosis management. Next. I'm sorry, Sanjay bhai, next. So if you give optimal vitamin D, it may have impact on its role on tuberculosis, its impact on respiratory tract infections, its impact on COPD, and its impact on asthma. I have my personal experience that if your vitamin D levels are normal, even COPD patients getting number of exacerbation is reduced. Also, the time to recover is far better. Their muscle functions are far better preserved in people who take regular vitamin D. So supplementations can aid in preventing acute respiratory tract infection. Incorporating vitamin D supplementation to anti-tuberculous regimes has benefited patients. And I would also want to share, it is even important to treat all family members of tuberculosis case with vitamin D3. It is observed that all those nearby or the family members, if their vitamin D levels are better, normal, their chances of developing TB is far less, and hence vitamin D could have role in reducing the spread of disease like tuberculosis. Next. Sources, and yes, enough sunlight exposure. Skin could synthesize 20,000 of international units of vitamin D3 in 20 minutes when exposed to good sunlight, and this vitamin D is absorbed from your back, from your chest, and hence it is important that you take sunlight directly without any interface in between. That means there should not be any glass in between. It should fall directly on your back, and that could give you adequate vitamin D levels. So there are natural sources of vitamin D3, and there are supplements available. And what I would, yes, please, next. And the supplements, there are various schedules given. Uh, Supplements could be given on daily basis. You may have 100 to 400 international units daily, or it could be given on weekly or 10 days interval. Next. Many different recommendations are there. There could be about 2,000 to 4,000 international units of vitamin D3 in obesity. You may have to give higher dose of vitamin D in obese people because there is excessive adipose tissue absorption of vitamin D, and bioavailability could go down by 57%. And hence, whenever there is no evidence of toxicity of vitamin D below the levels of 150. So 100 and 150 तक तो कोई toxicity probably is not seen. Above 150, maybe you would see some toxicity. And if you give somewhere around 10,000 international units daily, indefinitely, in the sense for days together, there is hardly any evidence of toxicity. With those words, I would probably give you some take home messages, and that is vitamin D is essentially a micronutrient, but that acts as a hormone. Deficiency increases risk of various infections and autoimmune diseases. Vitamin D level impact the immune function, both your innate and your adaptive immunity. Vitamin D status improving lung immunity. It can effectively prevent many diseases such as respiratory tract infections and other diseases like psoriasis and certain cancers. Supplementation has protective role against COVID-19 related ICU deaths and even on mortality. Thank you very much for your patient hearing, and I'm sorry for all that technical hitch we had, and I wasted your 10 or 15 minutes. So I apologize for that, and thank you, Dr. Kalra, for helping me with this, for
Thank
playing
you,
my
Dr. Raghav.
slides. Thank you very much.
No, no, thanks a lot. The pleasure is ours. And here I am. Here's my camera on. Lots of questions and comments coming now, Dr. Agam. A wonderful talk, and you've made things so simple for us. We welcome everyone to the show. Sir, there is a question in vegetarian food. Does is vegetarian food enough for vitamin D, or if I choose to be vegan or vegetarian, I have to take vitamin D from outside?
Correct. That's a very interesting question. If you have to take, say, vitamin D, if you have to rely on milk for your vitamin D sources, Sanjay bhai, I'm sure you would agree, a glass of milk may have about 20 international units or less, and maybe with the current type of milk available, it may be even less. If you have to meet your daily requirements of, say, 2,000 or 4,000 international units a day, you may have to consume 20 glasses of milk minimum. I think that's not practical. So I believe in today's time, it is far more easier to take vitamin D supplements. So all these micronutrients, I'm very sorry to say that natural sources are inadequate, and to rely on adequate supply of these micronutrients, we have to depend on the supplements only. And the supplements come in various forms. It may be in your tablet form, the syrup forms, those depot preparations, injectable forms, etc., etc. When it comes to vitamin D, luckily, vitamin D can be taken once in 7 days to once in 10 days, depending on your vitamin D levels and your requirements. Sanjay bhai, you may have something to add.
No, what you have said is right, and I fully agree with you. Dr. Tala had asked about vitamin D levels, and you had shared those in your slides. We need something between 30 and 100, over 30. Seemaji
Yes.
asks about
I would say
hypothyroidism.
30 and 100 bhi nahi. I would say 50 and 100. 30 and 50 is just your sufficient levels, but optimal levels are between 50 to 100. To focus on making it somewhere around 70, 75. And again, in children, try to keep it somewhere around 80 and 90, I believe. Thank you.
Seemaji asks about hypothyroidism. The dose of calcium and vitamin D will be the same as in euthyroid patients. There is a separate disease called hypoparathyroidism. That is not so common, but still it is there. In hypoparathyroid, we need to give very high doses of calcium and vitamin D. And you need to give not only the native vitamin D, which Dr. Agam is speaking about, you also need to give activated vitamin D, calcitriol. Another question, Dr. Agam, for you. This is from medicine. What is the reason for pain in the fingers when I keep on typing on the computer? I get pain in my fingers. If I rest, then I am okay.
Pain in fingers could be multiple things. It may be your faulty, table, your length, your ergometries may playing a role. But if you have ruled out all those causes, and if you're looking at the biochemical causes or the metabolic reasons for it, of course, nutrition is one factor. So you may be low on your hemoglobin, you may be low on your proteins, you may be high or low on your thyroid, And of course, important is all nutrients, including vitamin D and vitamin B. Your B12s and D3 deficiencies could also do so. I would, and just not that. You may have to do adequate exercises, physiotherapies, and rest also during your frequent or long typing or computer sessions. Thank you.
Question was, which is the best herbal way to take vitamin D? That I think Dr. Vora has clarified. It won't work. We
I
have to
think
take.
you will have to ask Ramdev ji for this. I may not be.
We have to take. The plant kingdom does not create vitamin D. And a question related to that is about cholesterol. So, see the question, Dr. Vora.
Hmm.
Cholesterol in our body gets converted to vitamin D in the presence
Hmm.
of sunlight. So,
Yes.
if I take a cholesterol lowering drug, a statin, will
Interesting.
that reduce my vitamin D?
No, no. The cholesterol lowering drugs, no. They don't. How do I put it in the right words? They don't completely wipe off cholesterol out of your body. They lower the cholesterol, and you still have adequate cholesterols for them to, get converted into cholecalciferol. So don't worry about it. You may continue your cholesterol lowering drugs as per your needs, as per your advice from your physicians. That will not come in the way of your vitamin D.
And Seemaji points out, and rightfully so, that vitamin D deficiency can also lead to unnecessary hair fall. So that is another aspect. Vitamin D deficiency can reduce the
I think myself and
quality of
Sanjay, both of us need to take a lot of vitamin D, Sanjay.
health, yeah, hair and nail health as well. So in the past, when I was younger and when I was more enthusiastic, I have gone on extreme diets. Like very
Uh-huh.
restricted diets. I did lose a lot of weight, but my nails began to become brittle. So I realized I was on the wrong path.
Hmm.
A question is sunscreens. Do sunscreens really
Yes.
reduce the vitamin D division production?
Yes, yes. Sunscreen would definitely come on the way, and then there are various sunscreens available with different grades. So there are sunscreens which can be really harmful. But then when you see this sunscreen is to be applied on face. Sunscreen is to be applied on your arms and hand. Uh, Generally, the vitamin sunlight absorption is not good from these places. Sanjay, correct me if I'm wrong, or
Yeah.
try to put it in the better
Mm.
way. That sunlight is absorbed from the chest, from the back part.
The trunk.
And
The trunk.
that is the part. So what I recommend is you may apply sunscreens on face, on your extremities. But if you can keep your back open and let the direct sunlight fall on your back, that would be adequate for your good vitamin D levels.
In pulmonology practice, in respiratory practice, have you ever used 6 lakh units injection
No, I don't
vitamin D?
use. No.
Yeah. The speed, Dr. Nitin Narula, of vitamin D absorption is the same. If you give a good quality oral supplement, 60,000 units, and you give a 6 lakh unit injection, it's the same. I have used a lot of 6 lakh units in the past when we did not have better quality
Hmm.
oral
Hmm.
drugs. Now we have very good quality oral preparations, soft gels. So the results are actually much better. And see what Dr. Agam said towards the end of his talk. If you give this 60,000 oral preparation, there is no risk of toxicity. You can keep on giving indefinitely. The only
Hmm.
time you will experience toxicity is if by mistake or for whatever reason the patient takes 6 lakh units every week or every month for a long period of time. Then this 6 lakh units keeps on getting deposited in the adipose tissue and then we get in trouble. We also acknowledge the advertisements that are coming our way from Bengali doctor in
And
Jodhpur.
whenever you have
Yeah.
And whenever you have these high vitamin D levels, do look at other diseases as well. Being a chest physician, I would think about keeping an eye on sarcoidosis. You may have to look at
Hmm.
kidney injuries and kidney diseases. And as Sanjay Bhai said, there could be other endocrine disorders where your vitamin D could be high. And generally, when you're giving supplemental D, all you have to do is just stop the vitamin D3 supplements, and in few days, few weeks, vitamin D level normalize. So you don't need any treatment to reduce vitamin D levels if they are found high.
And Dr. Zahir Ahmad asks, could you repeat in milligram and in nanogram, what is the upper level above which what is the level above which we'll label hypervitaminosis D?
What is the level above which you label
There's
it as
toxin.
hypervitaminosis?
Toxin.
150. 100 to 150 is hyper, and more than 150 it would be your toxicity.
That is in nanograms.
Yes.
Dr. Manju Vadikhai asks, let me take this question. You've spoken of vitamin D and immunity from a chest perspective. What about diabetes? The answer is yes, it is important. So, just like Dr. Vora said, people with vitamin D deficiency have frequent exacerbation of respiratory disease. They also have frequent infections in diabetes, and then they get in trouble. So, if we are able to optimize vitamin D, if we are able to give nutritional optimization, we will be able to optimize diabetes control more easily. So, Dr. Manju, there is this hierarchy. First, you need lifestyle optimization, then nutritional optimization. Within nutrition, macro and micronutrient. So, first, macronutrient, ensure adequate proteins, ensure the right type of carbohydrates. And in micronutrient, the term that we use is hidden hunger. So there is a lot of hidden hunger in our society. That means the proteins and energy is fine, but there is not adequate iron or folic acid or B12 or vitamin D. So inadequate electrolytes, inadequate uh, vitamins, inadequate minerals. And that is where vitamin D has a role to play. If you are able to unhide this hunger and then correct it, giving vitamin D, you will be able to improve immunity as well. And Dr. Chetwal, so like we said, it is virtually impossible to see hypervitaminosis D after oral vitamin D supplementation.
So, sir,
Dr.
in fact, 10,000 inter units a day, international IU a day, has not given, hypervitaminosis or toxicity levels. So, up to that, 10,000 can easily be tolerated.
And in children, it will be according to the body weight, but you can give
Hmm.
60,000 units once a month, even to small children. This question was from Dr. Smita. There's one question, again, medicine. Is vitamin D not given after kidney transplant?
I have no idea.
Yeah, but it is given actually. The only thing is that after kidney transplant, you are more cautious and you do the testing before giving. Otherwise, in routine patients, we would not even advocate testing. You can give vitamin D just like that. The kidney transplant patient will get regular tests done every month initially for many years. And as part of that, they would do the vitamin D. They might do the PTH also, parathyroid hormone. And if the parathyroid hormone is high, or if vitamin D is low, only then they will supplement. Okay, and there's a question. Vitamin D level has gone to 129 and vitamin B12 has gone to 2000. Patient is asymptomatic. What should I do?
Nothing. Do nothing. Just observe. In
Yes.
in vitamin B12, D3, all will come down in time to come. If patient has got, in fact, you don't need to do anything for this vitamin B12 and vitamin D3 high levels. Thank you.
Yeah. B12 will come down within a few days. Vitamin D will come down within a few weeks. And just cross check for over the counter supplementation. Maybe patient is taking some desi medicine. There might be anything. And the patient say, I'm not taking any drugs, not taking any medicines. But then here in Punjab, Haryana, the commonest question is the Canada wali auntie ne jo dawai bheji thi, wo say, yeah, that my Canada wali bua had sent me a big box full of I'm taking those every day. Or gummies sometimes. So just take a detailed history, alternative OTC, and even if you don't find anything, just tell them now to stop taking. Tell them to stop taking protein powder they're taken from the gym. It will come down within days to weeks. So with this, ओके एंड कितना रेखा पिटारा जी का मैडम का क्वेश्चन है एज 62 पे भी विटामिन डी में कितना होना चाहिए बॉडी में जैसे सर ने कहा मैडम 30 से 100 30 से 100 मगर 50 60 70 के आसपास हो तो बहुत अच्छा है Nitin Narula asks about the dose for lifetime use. So let me repeat 60,000 once a week for 3 months. That would be to fill the tank. And then once a month lifelong. In some patients, if you are overweight or obese or if you're at other risk of other diseases, then you might want to take once in 15 days as well. Many times we tell our patients, so we ask them, do you know the Hindu calendar or do you know the Ayurvedic calendar? And most of them say no. And then I tell them, see, this is a nice way of doing it. You take it every 14th day. We have lunar calendars. So this way you will remember the month as well. So, like for
Hmm.
example, just 2 days ago, the month of Zilhajj has started. The Arabic calendar, Zilhajj. So I remember that Zilhajj is easy to
Hmm.
remember because you go for Hajj pilgrimage during that time. So you tell everybody to do that. And Amavas Puran Mashi, that is full moon and no moon, or opposite actually, no moon and full moon. You remember those dates, you take your vitamin D along with that. So that's a nice way of remembering the calendar as well. With this, Dr. Agam, it's been great being with you. I'd like to thank
Oh,
you for
pleasure is
having
all
shared
mine.
your experience with us.
My pleasure. Had you not been there, I would have never got chance to connect to so many people and that too across the country. Thank you very much for the opportunity.
People are thanking you. And Seemaji, it will be around 60,000 units once a month for children above the age of 13. That's for, and for teenagers as well, maybe once in 15 days, once in 30 days. It depends upon body weight as well. With this, I'd like to thank everyone for having been part of our talk show today. Vitamin D is something that keeps us going, keeps us dynamic, keeps us strong. And if we keep ourselves vitamin D replete, vitamin D sufficient, we'll certainly become a stronger nation. When I look at our boys and girls on the playing field, the boys and girls who get medals for us, who get cups for us, I feel very happy. And when if we want them to be good at their game, good at their sports, they also want us to be fit. So how can we demand gold medals from our sportsmen and women if we ourselves are not fit and healthy? And the first way to do that is to take enough vitamin D and to exercise, to go out into the sun. So don't forget to go out for an evening walk today after this show is over, or for a post-dinner walk. With that, thank you, Dr. Agam, and Jai Hind.
Thank you. Thank you, everybody. Bye bye.
Goodbye.